Alex Sadge's life shattered the day he started smelling burning rubber and couldn't stop. The phantom scent stalked him everywhere: his apartment, his office, the grocery store. He scrubbed surfaces, replaced air filters, interrogated neighbors. Nothing worked. Because the smell wasn't real. It was a brain tumor, pressing against his olfactory center like a finger on an alarm button, screaming for help in the only language it knew. When Alex finally dragged himself to a doctor, the MRI revealed the truth: brain cancer. That phantom burning smell saved his life. Here's what most people don't know: your body broadcasts warnings long before you collapse. Unusual smells, ones nobody else notices, can be your first clue that something's growing inside you. Today, I'm breaking down 6 specific smells linked to cancer, backed by real cases and hard science. Some of these will surprise you. One of them could save your life, or someone you love. I'm Dr. Mitchell. I've seen hundreds of patients who ignored early warnings, and I've seen the lucky ones who didn't. Let's make sure you're in the second group. Can you really diagnose cancer by smell? No, not definitively, but certain smells should send you straight to a doctor's office. Let me walk you through 6 of them, starting with number 6, ammonia breath. If your mouth smells like cat urine or industrial cleaner, your kidneys or liver might be failing. When these organs can't filter waste, urea floods your bloodstream, breaks down into ammonia, and escapes through your lungs. In advanced liver or kidney cancer, patients literally breathe poison. Studies show end-stage renal failure patients can have ammonia, blood levels 10 times normal. Your body isn't subtle when it's dying. It reeks. 5th on the list, acetone breath and liver cancer. Keto dieters, pay attention. That sharp, nail polish remover smell might not be ketosis. It could be your liver giving up. When liver cancer destroys your ability to process fats and proteins, ketones pile up in your system and pour out through your breath. It's one of the earliest metabolic red flags in cancer patients, and most people mistake it for a diet side effect until it's too late. 4th place belongs to Alex and that burning rubber smell. But he's not alone. Jasmine Cooper from Chicago kept smelling burnt toast for weeks. It drove her to the edge of sanity. The culprit? A brain tumor pressing on her olfactory cortex. This phenomenon, called parosmia, happens when tumors damage the smell processing centers in your frontal or temporal lobes. Your brain starts inventing odors that don't exist or twisting familiar ones into something alien. Coffee suddenly smells like rotting meat. Fresh bread reeks of gasoline. Here's the key: if you're smelling something persistently that nobody else notices, or if normal smells suddenly turn grotesque, that's not quirky. That's a symptom. Brain tumors come with friends: headaches, seizures, vision problems, speech difficulties, memory gaps, even psychiatric breakdowns. Now we're entering the top 3. 3rd place, the smell of rotting meat. This one's brutal, and if you're experiencing it, we're likely past early detection. When tumors reach advanced stages, they undergo necrosis, tissue death, and release the same compounds you'd find in decomposing flesh. Doctors encounter this with late-stage skin cancers, breast tumors that break through the surface, and certain lung cancers. The smell is unmistakable and horrifying. By this point, you'll have other symptoms screaming at you: wounds that won't heal, ulcerations, relentless pain. I pray nobody watching this ever reaches this stage. If something's wrong with your body for more than a month or 2, stop waiting. Get checked. 2nd place, feces, breath, and colon cancer. I know what you're thinking. Stool never smells great. But this is different, and trust me, you'd know it. We're talking about breath that reeks of bowel movements, often accompanied by black, tarry stools, blood that's been digested, and a putrid odor from decaying intestinal tissue. Research shows colorectal cancer actually alters your gut microbiome, changing the chemical signature of your waste. After 50, you need to watch your bowel habits like a hawk and get a colonoscopy every 2 years minimum. Yes, it's uncomfortable. Yes, you can request sedation. And yes, it's non-negotiable if you want to catch this cancer before it spreads. The colon is buried deep inside you. You can't see it, touch it, or feel it failing until symptoms appear. By then, you're behind. Don't let discomfort or cost kill you. Your health isn't a place to cut corners. And now, first place, the smell that tops every other warning sign: chronic foul breath, medically known as halitosis. We're not talking about morning breath or garlic aftermath. This is persistent, penetrating odor that signals digestive system disease and pathological bacterial overgrowth. It's the hallmark of head and neck cancers. Tongue, palate, larynx, throat, even bone structures in your skull. Why does cancer rot your breath? 3 reasons. First, tissue necrosis. Tumors destroy surrounding cells, and dead tissue releases volatile sulfur compounds that escape through your mouth. Second, infection. Tumors create perfect environments for bacteria, which feast on dying tissue and belch out foul-smelling waste. Third, saliva disruption. Some tumors damage salivary glands, or the nerves controlling them, drying out your mouth and letting bacteria run wild. But here's the thing: bad breath never arrives alone. You'll see non-healing sores in your mouth, pain when you swallow or chew, voice changes or hoarseness, and swollen lymph nodes in your neck. If you've got persistent halitosis plus any of these, you need a doctor today, not next week. Your body speaks in a language most people never learn to understand. Fatigue, weight loss, swollen nodes, we know these. But smells? Most people ignore them or blame their diet, their hygiene, their imagination. Don't make that mistake. Not every strange smell means cancer, but every strange smell combined with other symptoms deserves investigation. Which of these shocked you most? Drop a comment below and subscribe if you want more life-saving information from an oncologist who doesn't just research cancer. I cut it out of people's bodies every single day. This isn't theory. This is survival.